Hello everyone. Today, we're exploring the medication known as Zantac, with its generic name being ranitidine. As always, our discussion is for educational purposes. For health-related concerns or questions, always consult a medical professional. Zantac, or ranitidine, is part of the drug class called histamine 2 blockers. Its primary function is to reduce the amount of acid produced in the stomach. Historically, Zantac has been prescribed to treat and prevent ulcers in the stomach and intestines. It has also been used to address conditions where the stomach produces excessive acid, such as Zollinger-Ellison syndrome. Additionally, Zantac was a common treatment for gastroesophageal reflux disease, GERD, and other conditions where acid backs up from the stomach into the esophagus, leading to heartburn. However, due to the discovery of a cancer-causing impurity in many ranitidine medications, the FDA has requested the withdrawal of this medicine from the U.S. market. Zantac has been withdrawn from the U.S. market. Some of the information provided here is preserved for historical purposes. Using Zantac might increase the risk of developing pneumonia, with symptoms like chest pain, fever, shortness of breath, and coughing up green or yellow mucus. It's crucial to differentiate heartburn from the initial symptoms of a heart attack. If you experience chest pain, a heavy feeling, pain spreading to the arm or shoulder, nausea, sweating, or a general ill feeling, seek emergency medical attention immediately. Those who have been on prescription-strength Zantac should consult their doctor about safer treatment alternatives before discontinuing the medication. If you've been using over-the-counter Zantac, it's advised to stop and ask your doctor or pharmacist about other approved OTC stomach acid reducers. Heartburn can mimic the early symptoms of a heart attack, so seek emergency medical help if you experience chest pain that spreads to your jaw or shoulder accompanied by feelings of anxiety or lightheadedness. Before using any OTC medicine to reduce stomach acid, discuss with a doctor or pharmacist, especially if you have other medical conditions, allergies, are pregnant, or breastfeeding. Although Zantac has been withdrawn from the U.S. market, historically, it was essential to take it as directed on the label or as prescribed by a doctor. For those who were on the medication, it could take up to 8 weeks for an ulcer to heal, and it was advised to continue using the medication as directed and consult a doctor if symptoms didn't improve after 6 weeks. Like all medications, Zantac had potential side effects. Some individuals might have experienced allergic reactions, including hives, difficulty breathing, and swelling of the face, lips, tongue, or throat. Other severe side effects included stomach pain, loss of appetite, dark urine, jaundice, fever, chills, cough with mucus, chest pain, shortness of breath, fast or slow heart rate, easy bruising or bleeding, and skin or hair problems. Common side effects were nausea, vomiting, stomach pain, diarrhea, and constipation. Always consult a doctor for medical advice about side effects. Zantac could interact with various drugs, including prescription and over-the-counter medicines, vitamins, and herbal products. It was always essential to inform your doctor about all medications and supplements you were taking. Zantac dosage was based on the specific condition being treated and the patient's response to the medication. It was crucial to follow the doctor's recommendations and the instructions on the label. Avoid. While on Zantac, it was recommended to avoid alcohol as it could increase the risk of stomach damage. Additionally, those on prescription-strength Zantac were advised not to stop the medication without consulting their doctor. FAQ. How long does it take Zantac to work? If you were taking Zantac for gastric reflux, improvement was typically noticed within 1 to 2 weeks. For heartburn, relief could be felt within 24 hours. For ulcer treatment, it could take up to 8 weeks for the ulcer to heal, with improvement usually noticed within 6 weeks. Closing. That concludes our overview of Zantac. Remember, this information is for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.